Welcome back to Office Hours Unplugged, where we chat with the most amazing and prominent PIs here at McMaster and researchers. Today we bring with us to the studio Dr. Kanwarpal Singh. Could you please introduce yourself to the audience and let them know a little bit about what you do here?
Thank you, Austin. Thanks for the invitation. I mean, it's an amazing opportunity to reach out to some of the students who are, I relate them to myself. Like I'm also from a very humble background. So to give a little bit introduction, my name is Kanwarpal Singh. I'm assistant professor at Electrical and Computer Engineering Department. I joined about 2 years ago, and I'm coming from Germany now, so where we had a lab that I started in 2018. So now I'm working as an assistant professor here at McMaster. And in our lab, we try to develop techniques that we think have like real applications in the world. Basically in biomedical world. So we try to develop techniques that we can really like translate from lab to the to actual clinical settings. So that's the goal of our lab currently. Yeah.
And could you walk us a little bit about how your journey through your academic background really, how it really started? I mean, you mentioned earlier before we started filming that you were actually a electrical engineer by trade, pure.
Yeah. So to start with, when I was 5 years old, I studied paper on special relativity from Einstein. Oh, just kidding. Not really, right? Yeah. So my background is like very, very simple. So in fact, I can say that like I was never into pure studies.
Yeah.
My father was in army. My grandfather was in army. So I'm coming from India, actually, if you guys don't know that. So my brother was in army. My uncles were in army. So I was destined to be like going into army. And that's what I trained for, actually. So I never trained for being in an academic career. I was training actually the school that I attended as a kid. It's called Sainik School, Kunjpura, in a state called Haryana in India, and that's the goal. That was the goal, actually. So I wanted to go into army, and in fact, I trained myself for several years. I appeared for so when you want to join an Indian army as an officer in India, you have to actually appear for something called a Service Selection Board (SSB), which appears after passing some exams, which could be like at graduate level or undergrad level. And I appeared for that interview for almost like, if I'm not wrong, 11 times. And I am very confident that that's almost the highest number that anyone could go. Yeah. So the point is like I failed many times there. Not like I failed basically like all the times there, right? And then I thought, okay, like it doesn't seem that I can make it to army. So what's my second most the job that I enjoy most? And that was academics, basically. Not really academics, but it was more experimental science that I used to love. Like in India, we don't have very sophisticated laboratories, especially at undergrad levels. But still, like small experiments, you do experiments, you fail, you again try, you change something,
right,
and then see like how things are changing. So that was that's what I enjoyed, and I was okay with that. And then I thought, okay, like if not this first preference, then what's my second preference where I can kind of like enjoy and do something, and that's how I got into science, basically. And then around like when I completed my master's degree in India. I still had to do like one research project, which is like 1 year. It's same kind of like thesis project that we do here also at master's level. So I was doing my master's thesis, and then I said, okay, what I can do. So I started looking outside. So there was a professor back in India, and he recommended that students from outside, they also go outside to do their master's project. And I said, okay, that's a good idea. So I applied almost like 400 places or even like more than that throughout the world. And I got like only one response. I got interviewed for that. It was Professor Jose Azaina in INRS, which is a institute back in Montreal. So it's a research institute, and I interviewed with him, and then he said, okay, like he would like to have me in his lab. And that's how I basically moved to Canada to do master's project. After doing master's project, I basically was talking to other people around. I wanted to do my PhD, and then I met Dr. Sunichi Ozaki in NRS again, and he was doing a project which was at the intersection of engineering plus some biology. So we were trying to detect glaucoma using optics, basically. There was a technique called optical coherence tomography. It was not there at the time. The technique itself was there, but we were trying to figure out which techniques would be most suitable for detecting glaucoma. So we're trying to measure the expansion in the eye, and what happens is when the blood is entering into the eye, it kind of pushes the eye itself back and forth, and it happens every cardiac cycle. So when the blood is going with every cardiac cycle, the blood is getting pumped into the eye. And the blood was pushing the eye. So we were trying to figure out if the eye is if it is more flexible, then it would move more, and if it is moving more, then it would be stretching the wires that are connected between the eye and our brain. So that was the idea. So we started with that, and we tried many techniques. Again, it's a journey that you have to go through when you are doing this kind of research. That you do something, you fail. So we tried a couple of systems that were already available. Didn't work out. Then we did a little bit more digging, and then I figured out that the technique that I'm mostly focusing on, which is called optical coherence tomography. So I started working on that technique, and then we did develop a system, and that system kind of worked very nice. People are still using that system right now over there, and doing more research on that right now. There are a couple of students who are doing that. And then so it was a coincidence that I was appearing for the conference called Photonics North. I was giving a talk there, and my postdoc supervisor, Dr. Gary Tierney from Harvard University, he was also giving a talk there. And he said, we are looking for some students who might be interested. And he was also in optical coherence tomography. And I said, okay, that's a good opportunity. Let's try that. And my wife was, it's a big place. How would we do it there? And I said, there's no harm in trying. At the most, we can fail. That's what we have been doing, failing and improving.
Right.
So I applied with him. I interviewed with him actually 2 times. So because I was from a very humble background, so it was. So they also wanted to make sure that I'm the right person for that job. And finally, he said yes. Let's come to Boston. So I went to Boston. I was there for 5 years doing my postdoctorate there at Harvard University, actually in Harvard Medical School.
Wow.
He was a great mentor, actually, and that's where I learned the importance of hard work, you can say, because back in PhD I was enjoying working a lot. It was I had great mentors there too. They gave me the liberty to work on anything that I wanted. That's how I tried many techniques back in PhD also. But at Harvard, I saw that people were really hardworking. People who were working there until 10, 12 in the night. They were in the lab at 8. And even my supervisor, he was Dr. Gary Tierney. He was there you send him an email at 2 o'clock in the morning and he would respond back. And we were always surprised what he's doing. Does he ever sleep or no? And he was always available in the lab. Whenever you ask him, okay, I'm stuck at this point. Okay, I'm coming to the lab. Let me help you.
Wow.
So that was a really eye-opening kind of experience. That people, they don't differ much in terms of intelligence, but they do differ in terms of the amount of sheer work they put into a project. So that there we realize that it's the hard work that matters the most. Intelligence matters to some extent, but it's really the hard work that gives you good fruits. And then from there, in 2018, there was a opening. Actually, in 2017, there was an opening that came out at Max Planck Institute in Germany. It's one of the most premium institute in Germany, having most Nobel Prizes in the world, actually. And we again thought should we apply there? It's a very good institute. And then again the same thing came. Okay, there's no harm in trying. And we tried there. And again, I was applying to many locations, getting rejected from everywhere. I applied there and then got the interview there basically. And then I went. Then I joined there as a something called group leader. So I was there again for about 5 years. In 2023, I moved back here, then being group leader there for about 4.5 years. So I moved back here, joining as an assistant professor in electrical and computer engineering department. So that's about the journey that I have had. So lots of ups and downs, but it's good at the end, I would say.
Yeah, sounds like it kind of worked in your favor.
Yeah.
And just backtracking a little bit, because I was interested, because you mentioned your PhD work. So was it that in your PhD your first exposure to endoscopy, or did you kind of know that you were interested in that field while doing your master's or your bachelor's?
Yeah, so when I was doing my master's, I was working mostly, so the project that I came to work on in Montreal, that was mostly on using optical fibers. So we were mostly working in optical communications, developing these tiny devices that were kind of replacing the electrical components. That's a good research that's being done right now also. So trying to replace electronics with the optical components so that the processing can be done really fast, like in real time. Right. So that's the project I was working on. When I discussed with Dr. Suneki Ozaki, so this biomedical project was a little bit different than what I was already doing. It had like some aspects of optical fibers, but not really. But it was more like on the application side. So we are trying to use the knowledge that I have gained so far, which was in optics, and applying that into medical science. And that's what kind of like motivated me to get into that direction. So it was not really in endoscopy also, it was on eye ophthalmology. So we're doing imaging of the eye itself. And endoscopy I moved when I went to Harvard. So it was the application of, again, the same technology, which is optical coherence tomography, into endoscopy. So that's where I learned about endoscopy when I went to Harvard.
Okay.
Yeah.
Very interesting. So before that, you were just focused on the optical technology. Was it like the intersection, like you said, of the biology and engineering, and trying to find, trying to, I guess, mold both fields together, or combine both fields together to get the desired result. Especially because you said it's like application based, right?
Exactly. So whenever we are, we are engineers, and whenever we are trying to kind of like look at the things that we make. We obviously would like to see some application of those techniques, and that's where it got interested. Like that what got interested in like me interested into that field. That because developing a technique is one thing, but seeing its real application into something that can be usable. That's what motivated me actually to get into that field. So it was a very interesting field, like coming from engineering background and then working in a hospital. Where I could interact with the patients, and I could really see that the devices that we are making are really making some difference at some level.
That's amazing, because you actually see all the hard work you're putting in. Now you can actually see it being applied and helping people. That's really must have been a great experience.
That was indeed a very it was a great experience, I would say. Like interacting with patients and seeing your technology getting into a real field.
And kind of zooming out into just the research in general, would you say that of all the PIs that you've had, which one of them taught you the most about how to run a lab? Because you went on to run 2 labs at very prestigious places. It was the Max Planck Institute and now McMaster. So who taught you how to run a lab? Was it the experience you had at Harvard? Is that kind of where you got your mentality, or?
So running a lab is, it's never like one person can teach you everything. It's kind of a combination of like all the professors that I have had in my master's or in my PhD or in as a postdoc. So everywhere you learn like some aspect of running a lab. So when I was at a PhD level, my professors were like very friendly with me. They would spend like a lot of time in the lab, work. And I had professors, basically one was Dr. Mark Lesk. I had like 2 professors, Dr. Santiago Costantino and Dr. Suneki Ozaki, who were more on the engineering side. So all of them had like some aspect of research that was valuable for me in opening my own lab. At Harvard, it was more the amount of hard work that you see, and it's not even, I wouldn't say like it's even the professor. It's more your colleagues that teach you how to run a lab actually, because you see your colleagues working like day and night, working hard towards a technique. You learn more from them, I would say, rather than your actual professors. What professors teach you is seeing a bigger vision. Like when we are working on something technical, we are very narrow-minded, and then we see like we are working on technique and we focus only on that thing. But what I see from my professors was that you should always like keep a bigger version or like vision in your mind, and then obviously like work on these small projects that would allow you to reach to that bigger vision. So I would say like it was basically everyone who taught me like one thing or another that was like very helpful in starting the labs back in Max Planck and over here. Yeah.
And you mentioned seeing your colleagues actually taught you a lot. Was it maybe seeing how passionate they were? Did that kind of inspire you to be more dedicated to the lab? Is that what you were?
Yeah, exactly. So it's your colleagues that teach you most. What I mean by that is that when you see your friends who are working like alongside you, and obviously like you cannot be an expert of everything, right? You have to look to your friends to solve one aspect of something, and then you obviously like you learn from them. So in India we have a saying that watermelon change its color by looking at the other watermelons. Right.
Oh, yeah.
So that's what it is. Like if you have a team that is working hard towards a goal, then obviously like you are automatically motivated to do that stuff. If you're surrounded by people who are also like not that interested in doing something, not really enthusiastic, you lose enthusiasm like at one point also, right? So it's very important to surround yourself by people who are really enthusiastic about something that you are also interested in. And yeah, that's what friends are about.
It's very well put.
Yes. And that goes back to, I guess, the origin of research, right? Because the whole point of research is, human curiosity, human innovation. People want to, do something and contribute to the world, right? So would you say that it's really important to have that like passion and that drive as a researcher? Because, a lot of people, I think it's very easy to kind of get confused. This person is doing this and this person is doing that. Should I follow like the crowd? But would you say it's more important to, follow what you're most passionate about rather than following what most people are passionate about?
No, it's very important that you follow your own instincts. That's very important. But what it means is also that you have to take help from others as well. So you have to look at other people, what they are doing, and try to integrate their idea also like in your ideology. It's not just your own ideology. That's very important. So you can keep that at a higher level. That's what you want to achieve. But at the same time, you also have to look at other people, what they are doing, and take their help for sure. Like I cannot run a lab myself if I don't have my own students, right? So I have to take their help. I have a bigger vision, and then they are somehow kind of like filling their role into that vision. Right, so that's how you kind of like do your research basically. But again, if you don't enjoy what you're doing, then it's of no point. So at some point you have to enjoy what you're doing, otherwise it becomes meaningless.
Absolutely. Yes. And I'm just a little curious because, as Aus mentioned, you had a research team at the Max Planck Institute. You have now your own lab in the McMaster. I'm curious, are there any parallels between your work in the Max Planck in Germany and in McMaster? Because I know you did microendoscopy work in Germany. Is there any, I guess, experiences or learning moments that you learned from Germany and then you brought over to Canada? And also conversely, was there anything that was done in Germany that you thought should really be implemented in Canada? Because we were talking to previous professors, especially in Europe, who have experience in Europe, and Europe has many amazing systems in place that really help with research. So I'm curious, did Germany have any of that as well?
Exactly. I mean, working in Germany was very interesting. It was very helpful also in setting up my lab. So we started our first lab there. We developed like a lot of very cool technologies. And mostly of those technologies were something that were in form of a box that we could take from our lab to the clinic and do the experiments over there. Wow. Now those techniques we developed those techniques. So I would say like in Germany we were only able to develop those techniques. Now when we moved our lab from Germany to here, we did bring those technology back here in Canada. So most of those technology that we developed in Germany, they are now here in Canada, and we are starting like a lot of human experiment or human trials with those technologies, and now we are seeing like the real application in the medical field. We did like a couple of experiments back in Germany also. Most of those were in animal studies, for example. Now here we are trying to start those studies mostly on patients and see like if if we can produce something substantial here with those technology, or if we can help the Canadian population here, or like world population in general, basically. Yeah. So we did bring those technology back here so they are in our lab right now. We are again, everything was dismantled at that time, so we are again trying to build those systems back here in our labs. Most of those systems are back up and running again. So we'll be using those techniques soon in clinic now.
It probably really helps that this university is in such close proximity with a pretty big hospital, and is intertwined with the whole hospital system.
Exactly. So that's one of the biggest, I would say, helpful thing has been here moving to McMaster. Back in Germany, it was great, but we were like very far from the hospital.
Right.
So every time we had to carry our equipments in car or something like that. But one of the biggest advantages I think we have at McMaster is the proximity to the hospital. We have started several collaborations in gastroenterology department. Also, we are trying to start some of the collaborations in dermatology right now. And it has been very, very helpful. People are very, very nice here. They are always eager to collaborate with young investigators and cross-disciplinary, basically. Like people working in medicine, they are very eager to collaborate with people in electrical computer engineering. So I see that a lot over here, and I would say it's a little bit even more than in Germany. So people are very eager on collaborations here, and always ready to help you. I send an email to anyone in the medicine department, and they are so eager. Okay, we want to try your technique, and let's come and see what we can do. So that has been I think very, very helpful. So what I was mentioning, we are already very close to doing using our techniques in human patients right now. That would have been very difficult back in Germany. So I was there for 5 years. We were only stuck at the level of, for example, animal experiments.
Oh wow!
Here, within an year or so, we are already very close to using our techniques in patients. So that way, I would say McMaster is a great place to be for people who are working in the interdisciplinary sciences. And the reason is just because there are so many facilities that are available here that you can use and make use of those to achieve your goals.
And going back to your specific lab, I know you've had many labs in the past, but specifically the one you've opened in McMaster, would you say that I guess what is the original vision you had? Because I noticed that you are kind of covering endoscopy and then the optical imaging technologies you've learned. So it's almost like an accumulation of all your past experiences.
Yes.
So are you trying to kind of expand on all the techniques and the different technologies you've used in the past and expand them to the next level? Or is there another vision that you had in mind?
So if I talk about a single vision that we have for the lab, it's basically making these techniques that we develop in our labs available to general public. So what you will see is that most of the times, not even 1% of the research that you do in labs make it to actual public. That's unfortunate, but that's the reality. And we are trying to change that. So what we are trying to do is there are so many cool techniques that you see in terms of imaging. I can at least speak about. There are so many techniques, wonderful techniques that are available there, but they are on these big bench, lab, in big benches on the labs. That you just can't make use. You cannot transfer them to clinic. They're just not there. I mean, for basic research they are there, but they are not useful in an actual clinic. Right. So what we are trying to do is we are trying to miniaturize all those techniques and put them into something that is portable that you can actually carry it to the clinic. So that's the bigger vision that we have. That we kind of miniaturize all the imaging techniques that are wonderfully helping in general, in research, and take all those techniques into clinic so that we can actually use them into some real applications. So that's the bigger vision, I would say. So making techniques more affordable, much smaller, and much useful in actual clinical applications.
And just to talk a little bit about your current research, what would you say are the major hurdles that are stopping you from, that you probably also encountered at the Max Planck Institute, that are stopping you from fully going into clinic that you've still yet to overcome?
So the major hurdle, I would say, is coming from the fact that most of the techniques that you develop, you are an expert of that, right? So you develop that, in and out of that technique.
Right.
But the moment you take it to the clinic, either people are not interested because it's too complicated, or the technique is it's like just too, it is just like very complicated and it's not useful. Like it doesn't provide you the results that people have been used to. For example, like if you take the example of endoscopy, I mean, endoscopy has been there for eternity now. Like the first endoscopes, they were, I think, developed in somewhere like in 1800 or 1700s. And not a lot has changed, I would say, in terms of endoscopy. So there are like only few techniques that are actually being used. Still, when we talk about endoscopy, we only talk about white light endoscopy in general. And that's a simple light and a camera that is able to image inside the body. Okay, so not a lot of the techniques that we actually develop in the labs, they actually make it to the clinic. And the reason for that is the techniques, they are not really user-friendly, I would say. The techniques that are developed, they are like highly sophisticated. Doctors, they are not used to, they never heard about those techniques. And when they try to operate that, they are not even, they don't want to use that technique because nobody at the age of 50 wants to learn about a new technique. So we have to make these techniques like very simplified, so that, and especially now with the help of AI, I think that time is coming now where AI is going to help really in at least like in the medical field. It's really going to help a lot to bring this technology from bedside to actually bedside. So I think like there is a good chance here in general that these techniques will now progress a lot in terms of their acceptance in the clinic. So that's what I feel right now. And again, the challenge has been just the techniques, they are not that easily acceptable, especially if you're going from like one field into the another field, like going from engineering into medicine. They're like two completely different fields, and we have to somehow like bridge that gap. And the way you can do it is just like making it more affordable. Obviously, like economy is or the money that is needed for developing a system, that's a big factor. But the other thing is like making it more user friendly, so that they are easily acceptable by doctors. Yeah,
I can imagine the problems a doctor would run into if they had to troubleshoot it or whatever.
Yeah.
It would be, you would need to have someone trained on the specific ins and outs of the technique to know how to basically work around it.
And frankly, like nobody can train them on this thing. Like who has time to get trained on a technique that? And these doctors, like they're already so busy. I mean, think about the time that they give into the clinic. Some doctors, they spend like 14 hours, 18 hours in clinic when they are working out there. So they don't have time to work on a like learn a new technique. So it is us to our like to engineers that we make this simplified, or like at least like integrate AI or something that we do, so that this technique is not a burden on doctors. It's just like there to help them rather. Yeah.
And I'm glad you mentioned AI, because I think like implementing AI in technology, I mean, especially as AI is being like increasingly developed, and implementing in technology is very useful, because I imagine maybe you could even implement AI to interpret the images you get from the techniques. So I'm curious, have you been trying to kind of see how you can implement AI with endoscopes? Because I think that might be a promising.
We are already doing that actually. So there is a company called like AI Valley here based in Toronto. We are collaborating with them. We are collaborating with Dr. David Armstrong in gastroenterology department. So we are kind of collaborating together on integrating AI into endoscopy. So that and there are a couple of more companies who are doing that, and I think AI is here, and there is no escape from there.
Right.
So a lot of the tech, and it's useful. So it's not that it's not useful. So people are integrating AI into endoscopy and in other forms of imaging actually right now. So yeah, the technique is here. People are working on that, and we are also contributing to that. So our lab is also contributing to that. Yeah.
Amazing. And just zooming in on your lab a little bit. You're probably managing so many projects.
Yeah.
What would you say are some of your standout things that you're excited about that your lab is working on right now?
So it's a hard question.
We're not asking you to pick favorites, but anything maybe you think would be interesting.
So it's difficult to say what are the interesting. I mean, like, is there like any standing out? Like, if there's like single project that I can outline that's more interesting? Not really. I mean, like there are so many projects, and the reason we are working on those projects because they are interesting. Okay, and again, like I wouldn't say like it's a hit and try method, but it's more like trying different techniques, and which techniques fit into, and you will see that like depending on really applications, so there are like different, not one technique fits everything, right?
Right.
So you do have to try different technique and see like which technique fits to one particular disease. So we are trying like many aspects of the research. We are trying on developing endoscopes that are basically very high end in the sense that they are very expensive also. There are projects which excites me a lot are the projects that cost like very minimal amount of money, but they have like very applicative in the sense that we have developed endoscopes that cost probably like $10.
Right.
And you can just plug that to your iPhone or like a normal phone that you can take into like a very remote area and do the endoscopy there. So those are kind of projects, they excite me, but they are just from excitement for it.
Yeah.
But if you want to kind of like progress more in the science, then you have to do some challenging projects as well.
Yeah.
And those are the projects that are mostly they are like novel kind of like imaging techniques that we are trying to integrate into our endoscopes. But excitement, it comes from like everyday job, like you change something in endoscope and you see something new happening. So that's the excitement that makes you really like excited. So I wouldn't say like there is a big project that is like highly exciting. All project exciting, but I think like it's everyday success that's like more interesting to me. And I see if the students are happy, they are enjoying their work, that is exciting. Then I know that eventually we are going to get something out of what we are doing.
Yeah.
Yeah.
And
so,
you mentioned a lot of really promising things here with the projects that you referenced. What do you think are some of the potential implications should any of the stuff that you're working on in your lab go to the clinic?
Yeah, so like I mentioned before, so we are already working on that side. So there is one project that is already in the clinic right now. So we are doing our first human studies coming up like in 1 or 2 months now. Wow. We are actually doing it as a multi-center study. We are doing it in Montreal. We are doing it in British Columbia. So it's a multi-center study, like 3 hospitals are participating in this study. So obviously, like when we work on something, especially for my group, the goal is always to develop a technique that would make to the clinic. So we never try to work on something that's just for the sake of working. Obviously, like we do work on projects that where we are still like researching, but the end goal is always the same, that we have to take these techniques into clinic. We are also collaborating with, for example, people in dermatology, like doctors in dermatology department, where we are trying to measure the elasticity of the skin. So some people, they have a disease that called like systemic sclerosis, which is a disease where the organs, they become kind of like stiffer, and it doesn't allow them to work or like function in their normal behavior. So we are also like developing these techniques. Again, all these systems are portable, so we can take them to clinic and do our experiments over there. Yeah. So always the goal is always that we should develop a technique that is of actually some use.
Right.
Yeah. Yeah.
And I think we're running a little bit short on time. So just to give you one last question, it might be a little challenging, but I guess as a researcher, you've done so many different things. Yeah. Is there one particular accomplishment you're very proud of?
Yeah, you are right. It is a challenging question. I wouldn't say like it's one single accomplishment, and being a researcher, it's really difficult to say. I mean, like we are a very new lab, so saying something that we have accomplished this at very early on, it's difficult to say. But accomplishments, again, I say like it comes from like your everyday work. You make something, you see it is working, or you change something that dramatically changed your output. That's what is, I would say, like accomplishment is. So if you are aiming for like accomplishment, like one accomplishment, that wouldn't work, because that would come and go away very quick. So we have to focus on daily accomplishment, I would say. And daily we do see systems that are working, that are actually helping in the clinic, that are able to diagnose disease like at early on stages. Or that the devices that we are developing, they are helping in monitoring diseases, or they are helping also like in figuring out which drugs are better for certain diseases. So those are the accomplishments I would say like that I'm really proud about, because we see like things moving in the right direction. So like it's difficult to say like one single accomplishment, but I see like if students around me are happy, if my colleagues are happy, I would say like that's a big enough achievement.
Yes.
Yeah.
That's amazing. I mean, you make a good point, though. I think like you can even apply what you said beyond research, right?
Exactly, yeah.
Having small accomplishments every day, right? Sometimes if you have one big accomplishment and you're struggling to get that accomplishment,
yes.
you know, you're going to feel not motivated. There's going to be many problems.
Exactly, yeah.
But when you have, like you said, like small accomplishments,
Yeah.
even if it could be like just getting up in the morning, doing something, doing a little experiment here, having those small accomplishments, I think that's a very good point you mentioned.
That's really important. I think that's very important, especially now in this stressful life that we have going around here.
Yes.
It is very important that we feel happy about what we are doing.
Okay.
Yeah.
And I think we're going to wrap it up here. I've learned so much today, so we really thank you so much for joining us, for taking the time to share your story with us and your science as well. So thanks to everyone for listening, and we'll see you next time on Office Hours Unplugged.
Yeah. Thank you very much. Yeah. Thank you everyone, those who are listening. Yeah. Thank you very much.